Good afternoon, dear colleagues. I feel the pleasure of addressing you today, and I would like to thank the organizers of this meeting for inviting me. I'm sorry that I will not be able to join you live today. These are my disclosures. The WHO puts a high priority on HIV, viral hepatitis, and STIs within the concept of Sustainable Development Goal number 3, that is to ensure healthy lives for all at all ages. Although progress has been made in all three disease areas, the global response is still off track, and most global health targets for 2020 were missed. Today, I'm going to make a short overview of hepatitis B and C and HIV epidemiology across Europe, focusing specifically on Central and Eastern Europe. I will start with hepatitis B and C. This slide shows the progress required to reach the 2025 and 2030 targets for hepatitis B and C, which is 170,000 new infections for hepatitis B and 350,000 infections for hepatitis C, plus significant reductions in HPV and HCV-related deaths. Achieving these targets will require scaling up of interventions. This map includes the whole WHO European region and shows that Europe has the second lowest number of chronic hepatitis B cases over the globe. There is no European country among those that represent 2/3 of the global disease burden of hepatitis B in 2022. Half of the burden is among people who are middle-aged, and men account for almost 60% of all cases. By the end of 2022, the total number of hepatitis B infections globally is estimated as 254 million, and the European region 10,600,000. On a global scale, only 13% of people living with chronic hepatitis B had been diagnosed, and less than 3% had received antiviral therapy. Europe ranks third in diagnostic and fourth in treatment coverage of diagnosed hepatitis B among all regions, and the coverage rates are much lower than desired. This map includes data from EU countries on the incidence of acute hepatitis. The highest rates are among the middle-aged population, and the male to female ratio is 1:4. The major transmission routes are heterosexual, MSM, and nosocomial, and we can see that there are significant variations between countries and regions in terms of notification rates. While there seems to be a declining trend over the last decade since 2013 in acute and chronic hepatitis B cases in the EU countries, a significant rise has been noted since 2022, which is probably due to a post-pandemic effect of increased screening. While the rates of transmission routes seem to show a similar trend among all routes, vertical transmission from mother to child for chronic hepatitis cases is the most common transmission route, as expected. A systematic review of chronic hepatitis B estimates among the general population and key risk groups in EU countries and the UK compared the data from 2017 database, these gray dots, with the post-17 data until 2021, these colored dots. And it showed that although infection prevalence was significantly high in several studies from specific countries such as Bulgaria, Greece, Italy, and Romania, all of which are Central European countries, it declined between 2017 and 2021, as you can see on this table, in the general population, pregnant women, and men who have sex with men. And this is probably due to improved vaccination, screening, and treatment in these groups. However, the proportion infected with HPV among prison populations and migrants was particularly high in several studies, again from Bulgaria, Greece, Italy, Romania, and this time the UK, and it has increased since 2017, as you can see on the table. There was not much information for Eastern Europe, particularly among MSM and migrant groups in this study. The story is different for hepatitis C. Europe has the third highest number of chronic hepatitis C cases, and 3 Eastern European countries, the Russian Federation, Ukraine, and Uzbekistan, are among the 10 countries that account for nearly 80% of the global disease burden of hepatitis C in 2022. Similar to hepatitis B, half of the burden is among the middle-aged population, and men account for 2/3 of all cases. The total number of hepatitis C infections globally is estimated as more than 61 million, and for the European region, 7,700,000. Only 36% of people living with hepatitis C had been diagnosed, and 20%, this is between 2015 and 2022, and 2% had received curative treatment. Diagnosis and treatment coverage for the European region is much below the global average. And this is the current situation in EU countries, with notably high rates in Central European countries. The male to female ratio 1.6. The most affected age groups are middle ages for males, a little older for females. And the major transmission route, as we all know, is injecting drug use, which accounts for more than half of acute cases and more than 60% of chronic cases. Now, this study compares data between 2010 and 2019 for the WHO European region, which we know also includes the Central Asian countries in the Eastern European region. And the age standardized incidence rate of acute hepatitis B decreased by 22% and the mortality rate by 33%. HPV-related cirrhosis prevalence rate was reduced by 20%, and the mortality rate by 33%. The reductions in disability-adjusted life years estimated for acute hepatitis B was 28%, and for cirrhosis, 30%. The parameters for HPV-related liver cancer stayed stable. If we analyze the regional differences from 2010 to 19, the incidence rate for acute hepatitis C in Central Europe decreased by 40% in Eastern Europe and 22% in Central Europe. The prevalence rates showed a similar decreasing trend in the two regions, and the deaths due to acute hepatitis B were highest in Eastern Europe, but showed a higher reduction by 31% compared to the 18% in Central Europe. The mortality rate due to cirrhosis decreased in all areas, with Eastern Europe showing the highest reduction, but the burden of liver cancer remained stable within the 3 regions. For hepatitis C, the age standardized incidence rate of acute hepatitis C decreased by 3% and the mortality rate by 35%. The age standardized prevalence rate of HCV-related cirrhosis and the incidence decreased by 6% each, and mortality by 11%. The burden of HCV-related liver cancer remains stable. When we analyze the regional differences, the age standardized incidence rate of acute hepatitis C is highest in Eastern Europe and decreased slightly during this period, and the reduction in Central Europe was 6.5%. The prevalence rates remained constant in both regions, and the mortality rates decreased significantly in Eastern Europe by 44% and 28% for Central Europe. The age standardized prevalence rate of cirrhosis was reduced by 7% in Central Europe, but no significant change was observed for Eastern Europe. Similar trends were observed for HCV-related cirrhosis mortality, and age standardized prevalence, incidence, and mortality rates for liver cancer again remained stable over this period. Currently, WHO is focusing on 38 countries for the viral hepatitis response. Together, these countries account for nearly 80% of viral hepatitis infections and deaths, and they face unique challenges in their responses to the disease. 6 Eastern European countries you see on the slide are included in this list. And finally, HIV. This slide shows the progress required to reach the 2025 and 30 global targets for HIV, which is less than 500 100,000 annual new infections and annual HIV-related deaths. Achieving the target, again, will require scaling up of interventions. This is UNA's data, and it has a different definition of Eastern Europe and Central Asia. It's different from the WHO definition. And Eastern Europe and Central Asia is among the fastest growing epidemics over the globe in 2023, with 140,000 new infections. And there was a 20% increase between 2010 and 2023. The number of AIDS-related deaths also increased by 34%, and this is the only region where the number of deaths is on the rise. The majority of new infections are among people from key populations and their sex partners, and the percentage of all populations except people who inject drugs here increased significantly since 2010, the highest increase being among MSM, and there was a small decrease of 10% in the percentage of people who inject drugs. The cascade of HIV for the Eastern Europe, Central Asia region shows that there are significant gaps in each pillar of the cascade, and the percentages are way below the global average. This is for 2023. In 2022, the new HIV diagnosis in the WHO region corresponded to a crude rate of 12.24% per 100,000 population, which is a slight increase compared to 2021 data, but a substantial decrease in the rate for 2019. When we compare the number of HIV diagnoses to the estimated number of new HIV infections in the light blue line, over the past decade, it's evident that an increasingly larger number of individuals acquire HIV infection than are diagnosed, and this shows that the population of people living with HIV who are undiagnosed in the region is growing. Late diagnosis is a challenge for most countries in the WHO European region, with about half of those diagnosed in 2022 being diagnosed late. And those who have the highest rate of late diagnosis is people who were infected by heterosexual transmission, and the lowest was for men who have infected through sex with men. While the number of new diagnoses in Eastern Europe showed a decreasing trend, you see on the yellow line, the numbers in the West and Center increased after the pandemic. While part of this may be attributed to a rebound in HIV testing and case detection after the pandemic subsided, the majority is thought to be the result of increased movement of people who were previously positive within and from outside of Europe. Almost 27% of total diagnoses and 29% of those with known information on the region of origin were reported among people originating from outside the reporting country. And this is more than 50% increase compared to 2021. Between 2013 and 2022, there was a substantial decrease in transmission by injecting drug use in Eastern Europe from 31 to 23%, a slight increase in heterosexual transmission. The number of male-to-male sex increased twofold, but transmission through this route remained low overall. The number of HIV diagnoses for which the mode of transmission was unknown decreased by 18%. For Central Europe, heterosexual transmission increased dramatically by 76%, and again this was attributed to the increased proportion of people infected through heterosexual transmission originating outside the reporting country. There was a slight decrease in transmission through male-to-male sex and a significant reduction in transmission through injecting drug use. Those with missing information on transmission mode increased from 12 to 18%. In conclusion, we have ambitious targets to achieve for hepatitis B and C and HIV within the following 6 years. Although we have made a lot of progress within the last decades, we are still off scale and we could not reach the targets for 2020. Achieving the targets will require scaling up of interventions, as I mentioned, and we have all the tools to end the epidemic. And all we need is greater commitment from governments, national and international organizations, civil organizations, and donors. Thank you for your attention.